Thanks, Michael. Macca was actually working out of our offices when this came up and the program came up, and he threw it out there to see if we'd be interested in partaking. I jumped at the opportunity for us to participate in it. Ever since I'd been working in the office, it had sort of disturbed me how many drivers I'd seen join our company, and they came in as quite fit-looking individuals, and then you'd look out the window at them, and 6 months after they'd joined, you could see a deterioration and another 12 months of further deterioration, and it was a disturbing trend that I wondered. I'd always sort of wondered in the back of my mind whether there was something that we could have been doing to potentially stop this. But by the same token, I went from when I was driving a bus, I actually found the job to be a really great job to be healthy. I thought, there's many things about it that allow you to live a healthy lifestyle while you're driving a bus. Most of the drivers that are with us, like all your companies, do broken shifts mainly, so they get a nice big period in the middle of the day to go and exercise. So at Forest Coastlines you can easily go off to the beach and have a surf or whatever. They do a lot of charter work where they can, they get 2 or 3 hours sitting waiting for their clients, so they can go for a walk or do whatever they want while they're there. Or at the end of every trip they get to often get out, stretch their legs and go for a walk. So that might be every half an hour or hour, which is a lot more than what a lot of office workers can get. And there also are a number of guys that drive for us and ladies that are particularly fit people. So it wasn't everyone that fitted this trend, but definitely was an element of our workforce. So I fundamentally don't think it's an inherently unhealthy profession, but I definitely saw the ability through this program to potentially influence some positive culture change within our company. So some of the things we did as part of the program, we had introduced the step pedometers, which are the little Fitbits things that attach to your wrist, that I'm sure most people have seen, that measure the number of steps you take per day. We had a health notice board. We put a bowl of fruit out for the drivers every day. We went to shop nearby food outlets that sold healthy food and sourced whether they could give us discounts on that food. We did had some physios come in and speak, as Nikki alluded to. We ran bullying and harassment training and introduced an EAP assistance program. The step pedometer, that's, the Australians love being competitive, so it's a bit like putting the fuel figures up on the notice board. If anyone's ever done that, the drivers love being competitive with each other. So that was definitely a good initiative. And some of these things I was a little bit dubious of at the beginning, and actually some of the things I thought would be not successful were, and vice versa. But the Fitbits were definitely a talking piece around the yard. And in fact, Scott Dunn from Telford's. He was showing me last night. He's got he's put it into his workplace, and he's got an app with a league table, which he happens to be leading. So I thought that was a great way of perhaps getting the whole workforce involved, and an easy way for everyone to interact and see how other people are going. The health notice board, that's one of those things you need someone to continue to put effort into. So I think that's somewhat fallen by the wayside. So we've just employed an HR manager. I assume that'll be a good job for her to perhaps get back to giving that some attention. The fruit bowl, that was one I was pretty dubious about, but that was probably, in the surveying, I think that came out as the most positive thing. So I think just having that reminder in the middle of the driver's room every day of the fruit bowl was just wasn't just about the fruit, it was about just having that constant reminder that the workplace did care about their health. The food outlets weren't interested. that was a little bit surprising. We had a fruit shop. We've got a fruit shop right next to our neighbour. They weren't interested, so that was a bit disappointing. Personal training, perhaps I think that's probably best left to the individuals outside the workplace. The bullying and harassment training, that was one that had me a little bit worried, because all the laws had just come in, and I thought to myself, oh, you know, the last thing we need to be doing is educating our staff on how they can take out claims against us on bullying and harassment. But what they actually did in the training was not just tell them what bullying and harassment was, but also told them what bullying and harassment isn't. So I think that's absolutely crucial, because, you know, a lot of people, as I'm sure you're all aware, when they're being performance managed, which is a standard part of every workplace, they like to think that they're being bullied or harassed. So that actually was hugely positive, and we never had any issues with that. The EAP, that was another one that I was a little bit dubious about, because I was worried about you know, drivers just getting a shrink and going and chatting to them every single day, and, you know, more or less you would be forking out money left, right and centre. But look, I'm sure a lot of bus depots have been through this, particularly smaller ones where the ops manager or the general manager is more or less is also a counsellor. But, you know, as we got bigger beyond 100 bus drivers, you get to that point where it's very hard for them to have that one-on-one relationship with everyone, where they know all about their lives. And there's also a little bit of you know, in the family business, a little bit of lack of confidentiality with some of these one-on-one sessions. So the thing I liked about the EAP was that, you know, you definitely get that confidentiality and a level of professionalism that previously didn't exist. We've had a couple of really positive situations with that since it's been brought in. There was one driver that I think it split with his wife had left him, and I think the ops managers noticed that he wasn't in a good state, so they suggested he went to the EAP. After he'd been down to Nikki's organisation, they immediately admitted him to hospital because he was a suicide risk. And well, he was back at work within 3 or 4 days, but, you know, he came into us and was extremely thankful that we were able to provide him with this support, because it was actually this support that, you know, it was only quite a short-term issue for him, but he definitely needed someone to give him professional advice rather than our ops manager. So maybe to just give you a little case study, success story. Nolene Jones, she was a picture of bad health before the program. I think I wanted to get a before and after. I think that's a before shot. She wasn't keen on she wasn't keen on getting any photos, so I had to use the license. Sorry. So she'd been with us over 5 years. Never ate fruit ever. Pack of cigarettes a day, sort of thing. Overweight. And didn't exercise at all. And 3 kids. She gave up on the smokes completely. She said that using the pedometer actually, you know, took her mind off the cigarettes. She's still off the smokes a year later. She found the fruit bowls. She started to eat fruit for the first time, and now she eats every day, and even says her kids have started to eat a fruit as a result of her changing her habits, which is great. On her meal breaks, which are typically at Chatswood Interchange, she goes to a health food store now instead of eating greasy takeaways. Says now children cook paleo pancakes. I don't know what they are. I think things people eat in Bondi, I reckon. So, you know, I think just that story alone actually is enough for me to be confident that the program has been a great success. And I think, you know, she's also saying that she's influenced a lot of the other drivers. And it became like a biggest loser contest. Everyone was competing. I mean, So definitely, I think that's the best success story we've had from it. So I'd encourage all the other everyone else to get involved with this program, whether you're a bus operator or not. This is relevant to all sorts of organisations, anyone that employs anyone really. The challenge I think for Forest is to capitalise on this, the success of this project, and see if we can continue to implement culture improvements in relation to health and well-being. There's always a risk with these initiatives that it's a bit of a one-off thing, and you slip back into old habits. So we'll be I guess for this particular initiative, it definitely focused on the drivers because that's who most of us employ. But we can definitely extend this to the entire workforce, and the mechanics. They're a pretty unhealthy bunch as well. So definitely, I can see some benefits of going there. I don't know what it is with them because whether it's working in Greece all day, but they've got pretty ordinary diets, the ones we've always employed. So I reckon we can perhaps do something next year with it and see if we can make some of the same improvements there. We'll be giving an award every year at our awards day for the healthiest driver of the year. So that's just something that just makes sure that we make it part of our regular yearly routine rather than, as I said, letting it slip away. I would also, if anyone's intending on implementing this in the workplace, you really got to get someone who leads the thing from the front, because if the person running the project isn't very passionate about it, you find that you definitely don't get that traction with the staff that you do need. Definitely thanks to BIC for asking us to participate in it. I'm very appreciative of that. So thank you.